Ask the Expert, brought to you by CommonSpirit Health.
We are back asking the experts at CommonSpirit Health. I'm here with Dr. Kendall Grose, and we've been talking about pain management with our back, how to get rid of that pain. I understand you have an awesome option for somebody dealing with a back fracture.
Yes. So we've traditionally used kyphoplasty for a number of years for someone with a vertebral body fracture. And in a kyphoplasty, we inject, or we access the vertebrae with a needle, and then we inject bone cement into the vertebrae.
Okay, and here there are, in that same arena, newer options as well.
We've had development of what we call now the spine jack kyphoplasty. So traditionally we've used a balloon where we enter the bone and we create a void space to put the cement. Now we use what's called a spine jack where we enter the bone, and then it's literally just looks like a little car jack where we're able to restore the height of the vertebrae, and then we fill it with cement.
And what is this that you're holding right here?
This is an example. This is not the actual one, but from the side view you can see that we have a little spine jack in there, and it looks just like a car jack. And then we're able to restore the height. The big thing with that is we can restore the biomechanics, so we can keep the body in its proper alignment.
That is just amazing. How soon can someone expect to feel better? So we're all wondering that, right?
I love doing this procedure. When patients wake up from the procedure, they're feeling at least 50 to 70% better when they wake up. A couple weeks later, I'll tell them 60 to 80%, and by the end of the month, they're 100% back to where they were.
That is an incredible option. Thank you so much for chatting with me, Doctor. Appreciate you so much, and make sure to stay tuned all morning long. We're going to be talking about more ways to get rid of that back pain, and if you want more information, you can go to the website on your screen. Thanks so much.
Thanks for having me.